Ask any doctor or nurse why they went into medicine, and they'll tell you the same thing: to take care of patients. But ask them what they spend most of their day doing, and the answer changes to something much more frustrating: fighting with their electronic health record system. Today, clinical burnout is at an all-time high, and monolithic proprietary EHR giants are largely to blame. They are clunky, they trap your data in silos, and they cost fortunes to customize. But a shift is happening. A quiet revolution built on transparency, flexibility, and community. Today, we're looking at Ciyex, the open-source EHR that is radically standing out from the crowd and redefining how digital healthcare works. To understand why Ciyex stands out, we first have to look at the crowd it's competing against. Traditional EHRs operate on a lock-in model. You buy their software and suddenly, you don't truly own your workflow anymore. Want a custom field for a specific clinical trial? That'll be a 6-month waiting list and a massive invoice. Want to integrate a new AI triage tool? Good luck getting through their proprietary APIs. Ciyex flips this model entirely on its head because it is fundamentally open source. Open source means freedom. It means the global healthcare community owns the code, inspects the code, and improves the code. With Ciyex, your clinic or hospital is never held hostage by a single vendor's roadmap. If you need a feature, you can build it, adapt it, or leverage a feature already created by another clinic halfway across the world. Let's talk about user experience. Most legacy EHRs weren't actually designed for clinicians. They were designed for billing administrators. They prioritize compliance codes over the actual narrative of a patient's health. That's why doctors joke that they have to make 40 clicks just to prescribe an aspirin. Ciyex stands out because it treats user experience as a clinical necessity. The interface is modular and radically intuitive. It adapts to the clinician's specialty rather than forcing the clinician to adapt to the software. By reducing cognitive load and cutting down on unnecessary clicks, Ciyex gives providers hours back in their day. Less time staring at screens means more time looking at patients. In modern medicine, data shouldn't live on an island. Patients move between primary care, specialists, imaging centers, and hospitals. Yet, getting legacy systems to talk to one another feels like translating ancient languages. Ciyex stands out because it was built from the ground up on modern, native interoperability standards like FHIR and HL7. It doesn't treat data sharing as an expensive add-on feature because it's open. Integrating external digital health tools is seamless. Ciyex acts as a fluid nervous system for health data, ensuring the right information is in front of the right provider at the exact moment of care. Then, there is the bottom line. The total cost of ownership for a traditional EHR can cripple a growing medical practice or a community hospital. License fees, user seats, mandatory upgrades add up fast. Ciyex eliminates licensing fees entirely. You put your capital where it matters, into tailoring the system to your needs, robust cybersecurity, and actual patient care. And speaking of security, with proprietary systems, you have to trust a third party with your most sensitive data. With Ciyex, you retain total sovereignty over your data. You can host it securely on your own private medical clouds, ensuring absolute compliance with local regulations like HIPAA and GDPR, backed by an open-source community that patches security vulnerabilities in hours, not months. The crowd of traditional EHRs is stuck in the past, built on outdated technology architectures and profit models that slow medicine down. Ciyex stands out because it believes healthcare technology should be open, intuitive, and boundlessly collaborative. Whether you are an independent clinic looking to escape predatory software contracts, a developer wanting to build the future of health tech, or a hospital system aiming to eliminate clinical burnout, Ciyex is the alternative you've been waiting for. It's time to move away from the crowd. Check out the link in the description below to explore the Ciyex codebase, schedule a live demo, or join their global healthcare community today. Thanks for watching, and let's build a better healthcare ecosystem together.